All right, thanks, Sam. Urinary incontinence is a loss of bladder control. It's a common and often embarrassing problem for those who suffer from this. Joining us live is Dr. Dimitri Volkan, urologist, surgeon, and director of public health with Hartford Healthcare's East Region. Doctor, welcome.
Hi, thanks for having me.
Great to have you. So explain, what is urinary incontinence?
Yeah, urinary incontinence, pretty straightforward. It's just an involuntary loss of urine, often associated with, being a female problem, but certainly men can suffer from incontinence as well. And it can range from something as little as a few drops of urine to complete loss of bladder control where there's large volumes of urine.
All right, doctor, what types of urinary incontinence are there?
There are a number of different types of incontinence, but there's basically two that are very common. The first being something called stress urinary incontinence, and that's related to an increase in pressure on the bladder. For example, when you cough, laugh, sneeze, lift something heavy, there's an increase in pressure, and that causes maybe some urine to squirt out. That's stress incontinence. And then the other common type is called urge incontinence. And like the name suggests, that's incontinence that is preceded by a strong urgency to go, or what people sort of think of as not being able to hold it when they're, let's say, driving in a car and they need to pull over and go urgently.
Does stress play a part in this?
That's a good question. Even though it's called a stress urinary incontinence, it doesn't really talk about anxiety type of stress, although there is probably some component, some small component to that as well.
All right, doctor, when should people be concerned about urinary incontinence?
That's a great question. I mean, I think in general, it's not something that's super urgent in terms of being evaluated. It's typically a benign condition. It can certainly be very bothersome, but there are certain things that people would want to watch out for if you're having incontinence that's sort of comes out of the blue, meaning you're doing well and then all of a sudden you develop incontinence. That's something that should be looked into. Certainly if it's associated with pain or blood in the urine, those are things that you want to get some prompt evaluation for, but otherwise it's typically a benign condition.
And doctor, quick last question. What are treatment options for men and women?
Yeah, there's a lot of treatment options, and some of that depends on the type of incontinence that you have. But sometimes it's as simple as changing your diet, changing some of the things that you're eating or drinking, doing some exercises of the pelvic floor muscles, strengthening those muscles. And sometimes it's a medication or a procedure that can be done in the office, in the operating room, but it's very individualized and we treat everybody on a case-by-case basis.
All right, Hartford Healthcare, Dr. Dimitri Volkan, thank you very much for this information. We appreciate your time.
Thank you.
Thank you.